Good evening, everyone, and welcome. My name is Karen Lindsay. I am a registered dietitian and nutrition counselor with the Susan Samueli Integrative Health Institute, part of UCI Health. I also hold the Early Career Susan and Henry Samueli Endowed Chair in Integrative Health, and I'm an assistant professor with the UCI School of Medicine's Department of Pediatrics. Thank you for joining us during our free community lecture, Integrative Insider Live. The Susan Samueli Integrative Health Institute offers integrative services at our main clinic on campus in Irvine, as well as UCI Health sites in Newport Beach near Fashion Island, Pacific Breast and Oncology Hematology at Pacific Medical Plaza in Costa Mesa, Yorba Linda, and Laguna Hills. Before we start, a few Zoom housekeeping items. We are recording this session. All registrants will receive an email with a link to the recording. To minimize distractions, everyone will remain mute and video off. Please utilize the Q&A feature at the bottom of your screen for any questions or to communicate with us during the session. After the presentation, I will moderate a Q&A session. Now on to the main event. For tonight's session, and because upcoming October is Eczema Awareness Month, we invite you to learn about eczema, raise awareness, and build compassion. We will explore integrative approaches to manage pediatric eczema, from conventional treatments to natural remedies alongside diet and lifestyle changes. You will learn about practical insights and evidence-based strategies to help manage eczema symptoms, promote skin health, and support your child's overall well-being. Lillian Au, ND, is a licensed UCI Health specialist in naturopathic medicine with the Susan Samueli Integrative Health Institute. Her clinical focus is on maternal, child, and adolescent health. She provides wellness care for infants, children, and adults, and treats a variety of acute illnesses and chronic conditions with evidence-based traditional and natural therapies. Her clinical interests also include allergies, asthma, ADHD, and neurodevelopmental disorders, as well as breast health, fertility, and reproductive health. Dr. Au earned her doctoral degree in naturopathic medicine from Southwest College of Naturopathic Medicine and Health Sciences in Tempe, Arizona. She completed a naturopathic residency at Natural University of Natural Medicine in Portland, Oregon. She also received a master's degree in public health from the UC Berkeley Maternal, Child, and Adolescent Health Program. Her postgraduate research at UC Berkeley and Sutter Health California Pacific Medical Center in San Francisco was focused on pediatric developmental screenings at early care and education centers. Her current research interests include the effects of nutrition and the environment on maternal and child health outcomes. Dr. Au is passionate about preventive care and patient empowerment. She takes a whole person approach to the health and well-being of the entire family. So please join me in welcoming Dr. Lillian Au to Integrative Insider Live.
Hello, good evening, and thank you everyone for taking the time today to join us for our Integrative Insider Live. I am Dr. Lillian Au, and I am a naturopathic doctor and a clinical provider here at the Susan Samueli Integrative Health Institute. My practice is focused in pediatrics, and I'm very happy to be here today to talk about eczema as October is Eczema Awareness Month. Eczema is probably one of the most common skin conditions I see in kids, and I'm here to present on the integrative approaches to pediatric eczema care and management today. Before we begin, I have no disclosures or conflict of interest. So here's our overview of our presentation today, as I'll be discussing the overall clinical features, skin physiology, and the pathology of eczema, and what integrative health treatments may benefit our patients with eczema. So with more than a decade of seeing children in my practice, eczema is also defined as atopic dermatitis, is one of the most common skin conditions that families consult us for naturopathic care. Eczema is generally termed as simply an inflammatory condition of the skin. It's a disease of skin barrier dysfunction and chronic skin inflammation, which underlying causes can be attributed to immune dysfunction, mostly due to an increased histamine response. If checked in blood work, we may see elevated IgE lab results or high eosinophils in our white blood cell counts, or specific immune function cells like abnormal T helper cells that respond to within our immune system that leads to inflammation of the skin. Usually eczema comes in stages. It presents in stages too. It commonly presents as red, excoriated, or crusting or dry patches or papules on the skin. And it's also characterized by pruritus or severe itching. May also progress into scaling or toughening of the skin in more chronic stages. And these stages can also overlap over time in presentation. And usually the course of eczema is characterized by severe to moderate pruritus or itching. And the course is usually marked by like chronic or relapsing exacerbations, triggers, or remissions of the skin inflammation. Eczema is, it's a little bit of background too. So on some of the clinical features of eczema. Eczema is one of the most common inflammatory skin conditions across infancy to adulthood. And it affects about 10 to 15% of infants occurring between 3 to 6 months old, with the onset of the skin rashes usually before 5 years old in 90% of our cases. Eczema may resolve or clear in about 40% by adulthood or become less in severity if well managed with treatment. Some patients may have a predisposition to eczema if there is a known family history of certain diseases, conditions such as asthma, allergies, seasonal allergies, or even eczema within the family that may predispose our young patients to eczema. There are some predisposing factors that show infants that have been bottle fed versus breastfed may show a higher predisposition to eczema, or even at the time with solid food introduction, which we may suspect if there is any underlying like food sensitivities or food allergies that may be triggering the eczema flares. Here are some examples of common presentations of eczema that can affect skin body-wide or affect specific areas characteristic to eczema. And that's usually what we may generally see localized to the face, the cheeks, the bends of the elbows or the knees, usually the flexor or extensor involvements in the upper and lower extremities. And then also ankle areas in infants and children is where most of the common presentations that we may see in practice. So eczema is categorized according to like internal or external causes, and usually surrounding conditions and environments that can exacerbate itching. These are the following physical and environmental triggers, such as dry skin, or also called xerosis, which may be due to low humidity, winter, temperate climates, dry air. Heat and sweat can be also a trigger and irritating to the skin. Irritants such as scented soaps or detergents, which is why with a lot of recommendations for types of cleaning products, skincare, this is why we recommend hypoallergenic products. Common allergens that are also associated with food or environmental triggers that have been positive on, let's say, blood tests or skin allergy tests too. Infants may also react to like simple food allergies that we may want to also investigate too. Common food allergies that we may see are cow's milk, nuts, tree nuts, peanuts, sesame seed, eggs, soy, gluten, and also even environmental agents too. Children may also react to stress, which also causes flushing of the skin, leading to itching and irritated skin. And that's just due to the increase of blood flow on the top of the skin that may cause that itching and irritation to the skin too, that may be also bothersome to the child. And also with the stress and flushing of the skin too, that severe itching may also lead to disruptions in their sleep quality as well. Also other triggers and causes too may be superficial skin infections that may become secondary to severe itching and then leading to scratching of the skin, which also increases like vulnerability of the skin and increases susceptibility and exposure to like bacterial, viral, or fungal infections. So with eczema, we want to first understand like basic skin physiology and the difference between natural skin barrier function versus dysfunction too. You can see here, this is a basic diagram of the functions of our skin layers that help keep the skin protected and moisturized. The first several layers are made up of proteins called filaggrin, which in short, it's called filament aggregating proteins. And that simply is a formation of the lattice-like structures that strengthens the layers or the integrity of our skin. And what's suspected with eczema patients is that, that they may carry a filaggrin gene mutation, and that impairs the production of the protective layer of the skin, the corresponding layer of the skin. And that is made up of these natural moisturizing factors. And these filaggrin breakdown products that play a role in antibacterial activity, regulating the pH of our top layers of our skin, retains moisture and reduces dryness on the top layers of our skin, which overall, with the skin barrier, is actually made up of 20 to 30% of fat and water. And overall, 60% of our water is in our skin alone. The filaggrin products and also the natural moisturizing factors too, they protect our skin from exposures to allergens and pathogens, which are infections, even UV radiation from the sun too. And with this understanding of the concepts of skin barrier dysfunction, this is what ultimately guides conventional and integrative dermatology treatments for eczema. And I'd like to provide an example of what normal skin versus like inflammatory or damaged skin. This is a comparison between normal healthy skin barrier with a diverse like skin microbiome on the top of the skin versus the damaged skin, which is there is an imbalance in the skin bacterial flora and disruption of those natural moisturizing factors, which will be abbreviated as NMFs, on the top layers of the skin. And this is where we see topical creams, emollients, skincare products, and the body's natural immune response protects our skin from allergens, infections, and environmental triggers that prevent it from invading those skin layers here and activating the immune system in response to an allergen or pathogen, leading to like increased sensitization and inflammation. So you can see here with normal skin barrier, our immune cells within our skin are separated by the functional skin barrier. That's the protective layers of our skin. It helps, and with the fats and water base in our skin layers, that protects any entry of allergens or infections from going through the skin barriers. And that is what prevents inflammation or irritation or infections in general. What we see here in damaged skin is that it's compromised. So allergens that have entered through an impaired skin barrier, and this may be because of an imbalance of the skin flora, also with the reduced natural moisturizing factors, the filaggrin mutations, that really reduces the strength and integrity of our skin. And this is where allergens and infections can also enter through the skin, leading to sensitization and inflammation of the skin in response to that. So a common question that I've been asked is why babies get eczema on their cheeks? Why is such a common area that we see that becomes the most irritated, the most inflamed? And this is where partly it's because the immune system maturing, and this is where the immune system around the cheeks, it's due to the longer developing natural moisturizing factors on the cheeks. It takes a little longer to mature and develop. And it's much more permeable in younger children, which eventually will mature into about age 5 over time. But with younger children and babies too, because with the contact of food and saliva constantly irritating their skin on contact, that really compromises and slows down the healing process. But over time, as their natural moisturizing factors and their skin barriers start to mature by the age of 5 and above, the skin can start to heal and improve with time and age and treatment. And that eczema can too be well managed or be outgrown with treatment alone too. So a big portion of our presentation today is why do families seek integrative and complementary therapies and treatments for eczema? Some of the reasons are largely by referral or mainly due to infants and children having tried and failed medication interventions, whether through their primary care providers, pediatricians, dermatology, or allergy specialists. Another common reason also too is that they might have had adverse effects from medication therapies, such as common topical steroids, or have had minimal or modest improvement with conventional treatments and therapies too. And usually parents are looking for other approaches such as diet, nutrition, and lifestyle counseling, and even supplements that may benefit the overall skin health and also symptom management too, if it's indicated. And if it's an appropriate treatment, dependent on the severity of the eczema flares. So some of the common measures for treating eczema is prevention and management of the skin rash. Treatment is usually focused on avoiding those environmental triggers, daily skincare with the skincare emollients or lotions, and or if it has to be combined with topical steroid if medication interventions are indicated. And also with dietary and lifestyle modifications that can decrease the overall itching, infection, and reduce the impact on scarring. So for an integrative health consult, we usually want to take a look at the comprehensive assessment of the patient's symptoms, their clinical presentation. A lot of times we're going to look at their medical and family history too, especially understanding if there's any underlying allergies, usually with if there's any history with asthma, eczema, seasonal allergies, if there's been any treatments prior to. We want to look at also diet and lifestyle habits, looking into if there's any specific food allergies. So we may look into knowing what foods could be triggers, and maybe also with recommendation to trial elimination diet too. A lot of times we may look into stress factors, sometimes with increasing anxiety, the social emotional health, that might also impact the negative effects on sleep, behavior, mood changes, and also itching exacerbations too. A lot of the common assessments that we may also look into the assessment and evaluation for underlying eczema is looking at certain nutritional deficiencies, and we may do lab work that looks at certain nutrients that may benefit skin health. And we'll talk a little bit about those when we look at integrative health therapies and treatments through diet and lifestyle modifications. So overall, with eczema, there's two types of clinical tools and scoring systems when we assess through a physical exam on a patient. And usually when we look at the physical signs, the symptoms, or we're measuring the severity of eczema through two of the scoring systems, which is the SCORAD, scoring atopic dermatitis, or the eczema area and severity index. And these will look at the signs, and then based on measuring the affected areas commonly that are affected on the face, the upper and lower extremities. And typically we may also have measures on clear areas to most affected areas too. So in the treatment of eczema, there are conventional treatments that are usually prescribed by pediatricians, dermatologists and allergists and specialists, but I'm going to focus mostly on the evidence-based integrative treatments and emergent therapies for eczema today. And this will be a discussion on diet and lifestyle modification, possible nutritional supplements, botanical or herbal preparations. Then we go through different integrative and complementary treatments for eczema. So it can be easy as ABCs with the understanding of the fundamental concepts of skin physiology and the pathology of eczema. And this is where it could help best guide us to the appropriate and tailored treatments for eczema. Because as we know, not all treatments can fit one person. Everybody's skin is different. The presentations are different. The severity is different. So this is why we want to have an understanding of the specific triggers, what indicated and tailored treatments that we can look at. First, the treatment of eczema does focus on avoidance of certain triggers, and this would involve a lot of education and counseling on diet and environmental control measures. And then usually collaborating and follow up with allergy or dermatology management too, if medications are indicated, but also to investigate too what underlying allergies there are to avoid. And then also medication treatments indicated for that as well. The importance of maintaining the skin's integrity is managed by certain topical emollients and lotions too, and also keeping the skin well hydrated and moisturized. That's another important barrier is skin maintenance too. And this can overall help to control inflammation and infection. So with proactive therapy and treatment can help with reducing those relapsing courses too. And we can look into appropriate testing as far as skin diagnosis too, whether it's an underlying infection or if it's allergy related, if there's nutritional deficiencies too. We may also want to look at that in appropriate testing, whether it's through skin testing or blood testing too. And then medication interventions with when and if needed to control symptoms as well. So these are the common conventional treatments for eczema that are based on level of severity. I'm just going to go over briefly about this because I think it's important to understanding the mechanisms of action of different pharmacological medication treatments. And they focus on treating skin inflammation. And the typical first-line treatments that we're also very familiar with are the topical corticosteroids like hydrocortisone type medications. And then for the moderate to severe eczema, it may proceed into stronger medications like immunosuppressant medications too, based on severity. Also widely used too are antihistamine medications that can be prescribed for allergen-induced eczemas, also specifically for symptom management. And there's specific allergen triggers too that have been assessed and evaluated for too. Also for the secondary skin infections, what's most indicated too is antibiotic treatments too, to help treat those skin infections and then also proceed to treating and reducing further inflammation and irritation too. So for overall integrative treatments and naturopathic therapies. A lot of it's mostly focused on diet and lifestyle modification, nutritional support, stress management for our pediatric family patients and families. Typically for topical support, I often recommend either thick creams or lotions that are ceramide based. So remember that our skin is made up of 20 to 30% of fats and water. So ceramide based lotions, they're the ingredients that help to restore the balance of fats on our skin. And they can be common over the counter brands that are familiar to us that we see, like Vanicream, Cetaphil, Eucerin, Aquaphor, Aveeno, or vitamin E-based lotions. You may see they're also very thick creams too. Other botanicals that also can help support the restoring balance of fats on the skin and also reducing inflammation and irritation too are calendula, chamomile, honey-based creams, colloidal oatmeal too, that also serves as soothing creams and reducing irritation overall. Hydrotherapy treatments, such as water-based treatments, such as oatmeal, Epsom salt baths, bleach baths, wet wraps may serve to help with symptom management, so soothing the skin, reduce itching, and preventing further skin infections too. And other adjunct integrative therapies that can also benefit and support like patients' overall care is also emphasizing like stress management practices too and improving sleep hygiene as well, which these practices can involve like increasing physical activity, breathing exercises, having good sleep routines with adequate hours of sleep that can support healing of the skin. So there's quite a bit of emerging literature on nutraceutical supplementation specific in the treatment of like inflammatory skin diseases. And I wanted to discuss a few today. We see that a lot of anti-inflammatory properties in omega-3 fatty acids, which is commonly found in fish that can benefit both children and breastfeeding mothers. Omega-3 fatty acids are found in a lot of fish or marine algal oil too that have been well studied, especially for breastfeeding moms and children, especially when it's given through either supplemental forms or through diet as well. Another herbal remedy to treatment is licorice. The topical licorice cream has been also shown to have anti-inflammatory properties in specific low percentages on a topical cream, can also help with reducing redness, swelling on the skin, and overall itching too. On nutritional support, we are looking at probiotic therapy in or not just oral, but topical forms as well have now been well studied in research. And this is what we're looking at in helping to improve the overall gut microbiome and the immune function of the skin. We see that some of the common strains of oral and topical probiotics, there is a lot of similarities as far as the Lactobacillus and Bifidobacterium strains too, which in children and infants, most commonly, these are the specific types of strain that is beneficial for maturing guts too, and will support it for their immune system as they're growing and developing. There's a lot of great studies on vitamin D, that there has been a correlation with low vitamin D serum levels on blood tests that's associated with eczema patients. And knowing that vitamin D is a cofactor in the synthesis of those proteins that's necessary for that healthy, normal skin barrier and helping with increasing and strengthening the skin integrity. And usually with vitamin D, if there was to be any oral treatments, it has to be monitored fairly closely too, because it is a fat-soluble vitamin, and it needs to be monitored either by serological testing to find the appropriate doses for that. So sorry about that interruption. Um, and then looking into antihistamines, so vitamin C, mast cell stabilizers that help with reducing the inhibiting the production of those T helper 2 cytokines that reduce the allergen burden and inflammation. Here we may see common foods that like vitamin C in our citrus fruits, quercetin, which is actually a plant pigment found in onions, grapes, berries, broccoli, and citrus fruits. And bromelain, that's commonly found in derivatives of pineapples. These help with reducing those mast cells and that histamine response, and ultimately reducing the allergen burden and inflammation. I wanted to share this graph, at least this diagram too, on the importance of the role of probiotic therapy in establishing a healthy gut microbiome. With different lactobacillus strains, we may see that it can improve the gut microbiome. And as we see here too, with children with atopic dermatitis or eczema, and then those with clinical symptoms that have improved with probiotic therapy, there is a relationship and correlation to the oh, sorry about that. I just have to see if there's slides.
Dr. Au, are you able to get back to your slide? I can try sharing my screen.
Can you share your screen? Sorry, there was a disruption in the presentation.
Okay.
Yeah. Mine's still sharing. Do you see the share on here?
I think I took over, so I think people can.
Is it visible now?
Yeah.
Okay.
Go ahead, and you can.
Sorry for the interruption, everyone.
Okay, it's okay. No worries.
So as we were just discussing too on the benefits of probiotic therapy in helping to establish like a healthy gut microbiome, as far as in the research, there have been studies that show that children with eczema or atopic dermatitis may have a imbalanced gut microbiome. And with some of the relevant beneficial bacteria that we may see, strains like lactobacillus and bifidobacterium too, this may help to improve the gut microbiome, helps to strengthen the immune system within the skin, and helps with the strength and integrity of the skin layers so that it prevents those allergens, triggers, infections from invading the skin. And this may see with even oral or topical probiotics, we may see overall clinical symptom improvement too, and positive outcomes even just from the treatment of probiotic therapy. So lastly here, I wanted to go over some of kind of the nutritional recommendations, dietary recommendations that I feel is probably the most important part of kind of the diet and lifestyle recommendations that I consult with my families. And this is surrounding foods that have the most anti-inflammatory and antioxidant benefits, healthy omega-3s, food-based probiotics, and also looking at those foods rich in certain nutrients. So the nutrients that we see beneficial as far as skin health and immune function are our foods rich in vitamin A, C, D, E, and zinc. And the following fruits and vegetables that we may eat in our diet that we can commonly find are those red, orange, and yellow fruits and vegetables. nuts, citrus, fish, cruciferous and dark leafy greens, animal proteins, beans, legumes, and lentils. These all have a combination of all these foods rich in these vitamins and minerals too. When we look at healthy fats, so remember, our skin is also made up of a percentage of fats on our skin. So having enough incorporated into our diet, but not necessarily having to supplement, can be really important if we eat the most nutrient dense, healthy fats. And that comes from fish or fish oil, olive oils, coconut oils, nuts and seeds, and even avocados too. When we look at oral like probiotics too, let's look at food-based probiotics as well. We commonly find that in our yogurts or kefirs, fermented foods even too. And, really also most importantly too, hydration status. I think as most important as how much of our skin is made up of water. Remember, it was about 64% of our skin is made up of water. And that specifically protective top layer is made up of 30% of water. This is where studies that have been shown a comparison between healthy skin versus inflammatory skin conditions, that because of that 30% of water has that protective nature versus someone with an inflammatory skin condition can have as low as 12% of moisture on the skin. And that can really affect and impair the skin integrity. So obviously stressing and emphasizing the importance of drinking enough fluids on a daily basis. And also importantly too, with eliminating common food allergies too. And some of the things that we may see that are common food allergens are cow dairy, eggs, peanuts, tree nuts, gluten, wheat, and sesame. And these can be also assessed by lab work too, to make sure that, are these the ones that are specific triggers to a child or breastfeeding mother's diet too. So to put this all together, I wanted to spend the last part of our presentation emphasizing our key takeaways in the integrative management and treatment of eczema. Number one is identifying the underlying cause, such as either allergy or immune responses. That's really key in effective long-term management of eczema. And this can be a successful collaboration with, pediatricians, primary care doctors, allergists, dermatologists, to finding the best treatment, either acutely or long-term management in eczema. Removing the triggers, so avoiding those common triggers like certain foods, fabrics, environmental allergens, even stress can prevent flare-ups and reducing irritation too. Thirdly is managing symptoms, alleviating those symptoms like itching and redness by using soothing topical creams or, baths to help with reducing redness and irritation. And also even like anti-itch creams to help keep your child's skin comfortable. And also protecting the skin. So regularly applying gentle fragrance-free lotions or moisturizers that supports moisture. That also, in addition, helps to strengthen the skin barrier too, preventing dryness and irritation overall. And lastly, treating eczema appropriately. And that depends on the severity of eczema, and also considering the use of combination treatments, either prescribed topical medications and or natural treatments under the guidance of a healthcare professional trained in the management and treatment of eczema. So I wanted to just say some last words that, just based on my experience now treating pediatric eczema, patients may often use various treatment options, both conventional, complementary, or integrative, and even over-the-counter supplements, products throughout their lifetime. I just want to end with the importance of proper management and proactive approach, whether it's with integrative treatments or combined with conventional interventions, because ultimately it will improve a child's quality of life and really direct the successful course of treatment and management of eczema. I wanted to thank everybody for your time. I've left some references here for the presentation, and I think we'll have some time for question and answer session. So really thank you for your time tonight.
Thank you so much, Dr. Au, for a very clear and informative presentation. I really appreciate hearing about the evidence base for different nutraceuticals and nutrients that can help in the treatment of eczema. I think as a dietitian background, that's really nice to hear as well.
Thank
So
you.
yeah, thank you. So I'm going to open up to our audience for questions. So as a reminder, please use the Q&A function to enter any questions that you may have for Dr. Au, and I will go through those. At the moment, as we don't have any questions yet from the audience, so as you're thinking of questions, I have a few things that I'd like to ask. So first of all, you mentioned at the beginning of your presentation that there's different classifications of eczema. They could be acute, subacute, or chronic. And I'm wondering, are there any treatments that you see being more effective depending on the categorization of eczema, whether it's conventional or integrative?
A lot of, especially with the severity of eczema presentations, a lot of it's going to be, typically everyone's presentation is going to be different. So all the treatments are going to be tailored to each specific patient. So we may trial one thing, whether it's supplements and topical treatments, but typically it can be universal, especially with the initial course of treatment. And if there's not a response, a clear response, we may modify the treatment plan to add in something else too, whether it's another topical treatment, whether it's combined medication interventions too. Those sometimes can be pretty beneficial. We may see some more positive outcomes. So for everyone, it's very much individualized. And this is where kind of the challenge in kind of treating skin conditions too. What we see usually in, our integrative health clinic here, we may see so many different variations and presentations of eczema, and everyone's treatment plans are going to be all different and tailored to each one patient, and not one patient is going to be all the same.
Yeah, thank you. So it sounds like it's kind of detective work, really, and
Yeah.
see what works best. Yeah, I appreciate that. So you mentioned there, sometimes topical treatments can help, and we have a question in the chat. Can you provide examples of some topical probiotics?
Yes, I know there are some formulations. I mean, if I can mention some brands, like Sione or Mary Ruth's has topical probiotics. And there are specific probiotics that's contained on the over-the-counter like topical sprays. And those are specifically different strains of lactobacillus or bifidobacterium, and another specific probiotic called Roseomonas mucosa. So some will have varying degrees of those different types of probiotics, but those are the ones most commonly found in over-the-counter products.
Okay, thank you. And speaking of over-the-counter products, another question we have, what are your thoughts on over-the-counter Zyrtec, so like an antihistamine for children?
So, with like medication antihistamines, they could be absolutely very beneficial in kind of managing some of the allergy-induced like triggers for eczema. And it can also really help with symptom management too. And that's just the medication forms of antihistamines too. Like I said later on in the presentation, there are some kind of natural like antihistamines that we can maybe incorporate into our diet too. That's found in certain foods like vitamin C or citrus fruits, quercetin or bromelain that's found in pineapples, and quercetin that's found in onions and grapes, berries, broccoli, and citrus fruits too. With antihistamine medications like Zyrtec or Claritin or Allegra, a lot of it's going to be trial and error too, to what also is really effective for the patient's treatment too, and also helping to reduce the symptoms that are triggering the eczema flares too.
Mhm. Thank you. And I just have a follow-up question to that. I'm, intrigued as well by the nutritional sources that you just mentioned of antihistamines. Has there been any studies that you know of, and sorry to put you on the spot, comparing the efficacy of these nutritional based antihistamines versus, the medication ones?
I mean, I've certainly seen some success with positive, positive treatment responses too from patients. Even if they couldn't tolerate, say, the medication antihistamines, it's something that we could trial too that would be in safe doses for children as well. And they can be a combination of vitamin C and some of the antihistamine supplementation too. And we may see some change in reducing some of the eczema flares over time, maybe also reducing some of the allergen exposures too, or the reaction to those allergen exposures as well. But a lot of times it does take time. So it's not an immediate response, but with time, we may see changes in sort of reduced eczema flares because there are also reduced allergen flares too, and allergen triggers or responses to the allergy triggers.
Great.
I think for Dave, our one question for the elimination diet, are you meaning the high histamine foods specifically? There are a lot of indications about certain high histamine foods versus low histamine foods. High histamine foods that might trigger like the overall systemic inflammatory response in the skin. I mean, for certain patients, it may be worth trialing this type of elimination diet. It's not a common recommendation for all patients, but if they're severely symptomatic, and we've trialed certain other recommendations and treatment courses too, it might be of certainly a consideration as far as like the high histamine foods, reducing those high histamine foods eaten in the diet, and maybe focusing on low histamine foods too. That's something that is generally patient to patient too, and each case by case. So thank you for the question.
Yeah, thank you for answering that question, because I know the low histamine diet can be a little challenging sometimes to follow. So we have another question here. Your thoughts about supplementing evening primrose oil and its omega-6 content. So I guess the question is, is there a concern of the omega-6 content of that?
So with evening primrose oil, if we're talking about pediatric uses of certain types of oils, there's fewer literature studies on evening primrose oil, but there's not to say that there's not an effect on omega-6 and omega-3 oils too that wouldn't have a benefit on skin health. I mean, I think all omega fatty acids too, if it's beneficial, but also in safe pediatric dosing, could be a benefit. And especially with foods that we consume too, could be great sources, and even supplemental like evening primrose oil. I think I've utilized it more in adult doses and adult treatment therapies versus for pediatric therapies.
Great, thank you for answering that. So I'm wondering if there's any more questions when it come into the chat or the Q&A function. If we're just waiting, just in case somebody else has a question, I just had another follow-up question as well for you. So you mentioned about the gut, right? Which the gut microbiome being such an important part of probably like we can consider it an extension of the skin, really, or the skin an extension of the gut, one way or the other. And that explains why, an imbalance of the gut microbiome might be related to eczema in some cases. I'm wondering, have you ever seen in your practice, if you address the gut in terms of trying to heal the gut, do certain food triggers ever become less of a problem for people's eczema or children?
I think with mostly what I've seen in practice is if there is, let's say, a diverse bacterial microbiome in the gut, that may reduce the kind of allergic flares to certain foods. It may not be completely, resolved, but over time, with the immune system becoming much more stronger, much more able to tolerate certain trigger foods too, and that may also go to the immune system's response too, as far as histamine response, the IgE levels, the white blood cells that actually help to treat and monitor for like allergies too, they become less of a burden on the body and on the immune response too. So I have seen, improvements as far as like food tolerance, where in the past there was food intolerances or allergy reactions become less severe or much more tolerable when once introduced after a period of time. But obviously with those cases, because food allergies can be so severe and we are concerned about anaphylaxis, it has to be monitored closely, either with a trained healthcare provider, an allergist, and also having the medications needed in case there is a relapse or recurrence or an exacerbation too. So sometimes those things have to be carefully monitored once they're introducing new foods that they've been allergic for. But I have seen changes in that.
Right. Thank you for answering that. Yeah, I think it's always wonderful if people who are eliminating foods can reintroduce them, like you said, if it's in a safe way and in a monitored by a healthcare provider. Um, so just one more question in case anybody else has something wants to put in the Q&A, but sort of on that line of reintroducing foods, like you mentioned earlier, a lot of kids who start with eczema and maybe infant life, they grow out of it quite often. I think you said maybe by age 5 or 6 is a common age range. So if there were trigger foods in that early life stage, can those children usually tolerate those foods to some extent later on then with issues?
Absolutely. If it's not a particularly severely allergic food, they can certainly be reintroduced slowly and maybe in, smaller quantities, over a period of time. And obviously with, monitoring, with families, diet diaries to just to also see too, if there's any reactions to those specific foods, they can be reintroduced slowly if they've had kind of mild to moderate reactions before, they can be reintroduced safely too.
Great.
Mhm.
Thank you. And then we have another question here. So somebody asked, nuts are okay, but just not tree nuts. Maybe just to
It's
clarify.
going to depend on, yeah, if they have a specific allergies. Peanuts, tree nuts, that's why there has been a lot of studies with reintroducing peanuts and nuts early on in life to reduce like sensitivity to potential like peanut allergies or nut allergies in the future. But obviously with certain family histories, there's going to be components where families do have severe food allergies too, that we just have to be careful when introducing certain types of foods too, especially nuts. Yeah.
Yeah. Okay,
Thank you.
great. Thank you for answering that.
You're welcome.
Okay. I don't see any more questions at this time, and I know we're coming close to the end of the hour. I think I've asked you all of my
Thank you
questions, so
so
thank you
much.
for that.
You're welcome. Yeah, I really wanted to thank everybody's time tonight for staying in on this presentation today. I really appreciate your time. Thank you so much.
Absolutely. Okay, so with that, we will close. So I want to thank everybody for joining us for our Integrative Insider Live community lecture. Upon ending the webinar, a pop-up window will have a valuable survey on this evening's event. Please help us improve our community offerings by letting us know what you think of this webinar. We will also be emailing the link to the recording and key takeaways to the email address provided at registration. Our next Integrative Insider Live is scheduled for December 7th. More information will be sent through our Integrative Insider monthly emails and posted on our events page on our website, which is SSIHI.uci.edu. Thanks again, and we will see you next time. Thank you so much, Dr. Rao.
Thank you very much. Have a good evening.